Okay, so we were talking about that on the patient coming to you with the complaints of sciatica aggravated in hot or summer weather. So what rubric you will consider in that case?
So page 339, sciatica heat aggravates.
Very good. So then the next rubric, sun heat exposure to, already we discussed, which is on page number 377. So you will open page number 146. Sorry, page number 146 of PHATAK Matramedica. You open page number 146 or 147 from PHATAK Matramedica.
Yes, sir.
Okay. So what remedy we are talking about?
Cadmium sulfate.
Cadmium sulfate.
When to use this remedy?
It is
Mostly in
for
CA stomach.
plasma. Plasma
Okay.
exposure to sun.
Okay, so if patient is getting plasma only after exposure to sun, then you are going to use the remedy cadmium, and cadmium is written under on page number 377 under the rubric sun heat exposure to. So it is not the plasma which patient is getting after exposure to the heat of bonfire or heat of gas or heat of radiation or heat of micro oven. So you will use only if the it is getting after exposure to this one. Then you will open.
Sir, please repeat the rubric.
Yeah, sorry, can you repeat? Because there's more than one remedy in there. Sun heat exposure to aggravates.
Yes, there are more remedies, but I'm just discussing only cadmium. Can anybody let me know the what you can say the cross reference for this rubric, for this remedy? You go to page number 61. There is one rubric that is cloesme sun exposure from, and there is only one remedy which is written cadmium. Page number 61. You got it or not?
Yes.
Yes, sir.
Now open page number.
Will not seen in cadmium cell.
You told the page 61.
Yes.
61.
And if you have the patient, if he is having the amelioration from sun heat, then what remedy we discussed just in our last session? What remedy we discussed, which was aggravation in summer and also amelioration in summer? Rhododendron.
Rhododendron.
Okay.
So then how will patient present if he is a rhododendron? There are two contrasting modalities in the same remedy.
Whatever you are if he is coming in midsummer, then you can consider the aggravation. And if the whole of the summer is whole of the summer or whole of the hot season he is complaining he is better, then you can consider that amelioration rubric. But rhododendron is
Thank you.
most of the time rhododendron is the remedy which we are using in most of the musculoskeletal diseases, and that too rheumatism of muscles, and that too rheumatism of bigger muscles like this of forearm, then of this deltoid, you can say tricep, bicep, then the muscles of thighs. In that cases you can think of rhododendron, not in the cases of mostly not in the cases of rheumatism of joints. That is what I have experienced. Okay. Then the next rubric will be on page number. You will tell me that sunlight aggravate. Here the patient will not be what we can say, सूरज की रोशनी जो होती है सनलाइट वो उसको सहन नहीं होगी. So the remedy over there is one of the remedies over there is glonine. Is it there? First, let me
Yeah,
note the
please
page
say
Yes,
number.
yes,
Page 242.
377.
Yes, yes,
242.
yes, sir. Yes, sir. I have order edition 334.
334. Okay.
377.
Yes, sir.
377.
Page number 242. Light sun aggravate.
Okay. That is new rubric to me. So I am here talking about the rubric sun light aggravate. So it is not necessary for the patient to go outside to have the sunlight to get aggravated if he is in his home. What we see in the movies, that to arouse from the sleep to someone, the curtain from the windows will get open and the sunlight will come in. So if you can think on this line that if the sunlight is coming and the patient is having what we say, the patient will having aggravation or amelioration, then you can use the rubric sub rubric on the page number 377, sun light aggravate. This is the sub rubric written under what we discussed, sun heat exposure to, page number 377. So glonine will not tolerate that heat.
On same page, there is a sunlight amelioration, rhododendron, and
Yes. So that is the beauty of PHATAK, sir. And if you go to page number 431, there is one rubric. If the patients are complaining that they are blind in sunlight. So the rubric is on page number 431, I think.
Sir, repeat rubric.
Sorry. Just wait a minute. 431 might be the page number of this one. Materia Medica. Lithium is there. You will go to Materia Medica, PHATAK Materia Medica, page number 431. You go to under eyes and just read the line what is written over there.
Sir, which medicine?
Lithium carb.
Sunlight blinds him.
Yes. So where we can see the rubric for this in PHATAK?
Page 377.
Very good.
Sunlight blinds lithium carb.
Yes, very good. So I just wanted to show you that rubric. Then you can add one remedy on, you may be getting the patients who are complaining of nose bleeding or what we say the epistaxis usually in summer. Are you getting such type of patients or not?
Yes, sir. Yes, sir.
Okay.
Yes.
So what can be the possible remedies? Do we have any such a rubric in PHATAK Materia Medica for such thing?
Crocus sativa.
Page number?
नहीं, Remedy, I am telling.
Very good. Crocus sativus is 1.
116.
What is the rubric, sir?
Epistaxis hot weather.
So,
Epistaxis heat with is also there, sir, on the same page.
but we are talking about summer, na? And that heat with means the patient
Yes, sir.
heat with will be different. The patient will have epistaxis, but along with that, he will also feel heat within himself. Then you can think of that rubric. We are talking here about the hot weather, epistaxis in hot weather. There is one remedy on page number 116. The remedy is written crocus. You can use this remedy in 30 potency with brilliant results. Followed by if the patient is craving lean thin as like phosphorus personality and bright red hemorrhages. They are usually bright red hemorrhages from nose in summer. Then you can think of phosphorus as a follow-up remedy after crocus sativus. If your patient is not getting cured after using crocus sativus, then you can think of phosphorus as a follow-up remedy, or calcarea phos, or any combination with phos you can think of, whatever is the patient's totality matches. If he is not getting cure with crocus sativus, and you can write down one more remedy if you want to over there, and that is glonine. Can anyone let me know the any more rubric for this? So you go to the page number 286, but that is not the presentation in summer. The rubric is nose bleeding, and there are two remedies written over there. One is phosphorus, one is vipera. But you can write down the another remedy, that is glonine, under the rubric what the sir right just now told, that is epistaxis hot weather. What was that rubric? Page number 116, no?
Yes.
So what is that rubric? Please read out.
Epistaxis hot weather.
So you can write down one more remedy over there, that is glonine.
Yeah.
So
Done.
glonine and crocus sativus. How you will differentiate? Glonine will have red face, he will have throbbing carotid, and he will have bright red hemorrhage, but that will be not like the what you can say, it will not be the drop by drop, but the patient will have the free flow. Patient will have free flow. So that is the case. Patient comes to you when I do give glonine in spite of crocus sativus. If the patient comes to me with the handkerchief, and if you remove the handkerchief, if there is thread, if the thread is forming to the nose and handkerchief, and I can see some stringy like hemorrhage within the nose, then I will prefer crocus sativus. And if the hemorrhage I will look very bright red, and the handkerchief is full of blood or more of the blood, then I will go with glonine. So this is the very subtle and short. In short, you can differentiate between two remedies.
Sir, on 117, page number 117, there is one more rubric. Epistaxis overheated being aggravated.
So overheated we already talked, ma'am. Na overheated is the physical exertion. And what I have explained this rubric, na epistaxis hit with, the both rubric have the same remedy. Suja.
Sir, 103 heat with soja. Epistaxis heat with soja.
Yes. So same remedy is under heated here, overheated, when what madam is talking about. You got it, ma'am?
Sir.
Okay. So we'll move to the page number
Oh,
2. We will move to page number 377. The rubric is sunstroke. If you want to utilize this rubric in your day-to-day cases, then you must be thorough with the knowledge of mater medica of each and every remedy, then and then you can use this rubric, because it is the condition. Sunstroke cases are the acute to emergency cases. They are not the chronic cases, or they are not the subacute. You need to act immediately. So you have the skill of observation very strong. And second thing, whatever is needed is the best knowledge of each and every remedy, differentiating point between all the remedies in this rubric. And if you have the chronic effects after sunstroke, the patient got the sunstroke 3 years back, 2 years back, 1 year back, and still he is having some complaints like he is having slurred speech, or he is having weakness in some of the part of the body, or in limbs, or he was hospitalized before 1 or 2 years for the sunstroke, and then the residual complaints are there, then you can use the rubric yes, sunstroke effects chronic. So sunstroke will lead to how the sunstroke happens. Please let me know. Or the sign and symptoms of sunstroke. Anyone?
Thirst, headache, throbbing, faint.
Okay.
Weakness, nausea, diarrhea.
Diarrhea, very less possibility, man.
Exhaustion.
fever, headache, weakness.
Okay.
Sir,
So
could you
whatever the symptoms are there, na, they will be, all the symptoms will be intensified. So you can think of some rubrics in such a cases, that sudden effects, violent effects, those rubric you can think of. And if you combine this rubric sunstroke with violent effects or sudden effects, you can get the set of very few remedies. You can go to the mater medica, you can read out all of them, and you can have that in your memory to get differentiated between all those remedies. Okay. Then the next rubric will come W warmth application poultice aggravate. So it is exactly not related to summer. Please let me know the page number.
$453.
Okay, and cross reference to this rubric you can see on page number 212. The rubric is hot application amelioration. So the rubric warmth means the intensity of heat will be lesser than the rubric of hot application amelioration, which is on 212 page. Hot means patient will have the intensity of heat will be more, which the patient will get relieved after that thing. So then we will use the rubric on page number 212 if the patient gets ameliorated by the more heat, and if he is getting ameliorated or aggravated by just the warmth, then you can use this rubric W warm application poultice aggravate. So there is just a difference of intensity between both of the rubrics. Am I audible?
There was a stoppage of
Yes.
maybe internet, something like that, because your voice was paused.
Okay.
So the
Yes, sir.
situation of the line was not clear.
No,
Okay.
sir. Voice to
Okay, so can somebody tell me what is poultice or written over that rubric? Poultice. Poultice is also there a Marathi word. What I will talk in Hindi for few lines. कुछ पेशेंट रेत या ईंट लेते हैं, उसको गर्म करते हैं और उसका सेक कपड़े में उसको बनाते हैं और फिर उसका सेक लेते हैं, तो उसके बाद उनके बाद उनका तकलीफ बढ़ना या घटना, तो वो हो गया पोटिस में। पोटिस के अंदर और कुछ चीजें आती है जो हमारे महाराष्ट्र में यूज किया जाता है। खाने वाला जो पान होता है, तो खाने वाले पान को थोड़ा घी तवे के ऊपर डाल के लोग गर्म करते हैं, और जब वो नमा गर्म रहेगा, दैट इज वार्म, तो उसके बाद में वो बांधते हैं, तो पेशेंट को आराम मिलता है। तो दिस इज द कंसेप्ट ऑफ पोटिस। ओके, सो वी हैव सीन दिस rubric and also cross reference hot application ameliorator on page number 212. The next rubric which is useful in summer, that is on page number 45, burns and scalds sun in. So you can just observe this rubric that patient is having the scalded. This is more you can see the what we say na our soldiers who are working who are protecting our country on the border of Rajasthan and Pakistan. There is tremendously heat. The temperature goes more than 47, 48, up to 49 over there in summers. If the body get they are on duty in this summer only. So in such a cases or farmers of that area, you can think of this rubric. You got it on page number 45.
Yes.
Then some patient will tell you that they will cough. Okay, sir. Some patients will tell you that if they will go to the sun, they will go outside in the sun and only that time they will cough. Then what rubric you will think? We are not talking about only summer over here. We are talking that patient complains of coughing whenever he goes outside in the sun. What rubric you will think of?
So page number 82, cough.
Good, ma'am.
sun,
Congratulations. Cough
antimtat.
sun. Yes. So single remedy, we usually think antimtat to be used in damp, wet weather, but this is the remedy where the patient will get cough only aggravated when he is in sun. Then the next rubric, you will open the page number 98. That is the direction of symptoms increasing with sun. So all these patients of page number 98 will have amelioration after sunset or in night because they are getting aggravated. They are getting their symptoms, directions of symptoms which is increasing with the sun. As the sun rises and it sets, they will get the pains increasing, and when there is sunset, the pains will get down. Pains, complaints, whatever you can say. And they will be absolutely fine in evening and night. Then you have to use this rubric on page number 98. Then if a patient comes to you with the complaints of eczema only in summer weather, then what rubric you can think of?
Sorry,
Or
so
what-
what's on page 98, did you say?
Yes, yes. It is there now or
What?
not?
No?
Direction of symptoms.
Oh, direction, sorry. Direction.
Eczema sun exposure from
Very good,
Only
sir.
one remedy,
So
sir, muriatic acid.
yes,
112 muriatic acid.
very good. So I don't have personal experience and I will not advise you also to use this single remedy rubric from PHATAK that eczema from sun exposure. If you have a clear cut history and your patient doesn't gives you any of the information other than that, then and then you can think of trying muriatic acid. Okay. So if the patient is
Sir,
huh?
Yes,
Sir,
yes.
this page 98 direction increase with the sun. That's
Yes.
what we have to take. Right?
Yes, yes. Then the next rubric will open on page number 121. Patient is getting freckles from sun exposure. Then again there is a remedy muriatic acid
Oh,
over
what
there.
page? Sorry, what page?
121. Okay. Then the next rubric you will open page number 29. Eyes looking sun at or anything white or red aggravate. Only two remedies are there and they are apis and second is lycopodium. Apis I usually
Sir, which page?
page number
Sorry, which page,
29.
sir? Okay.
Eyes looking sun at or anything which is white or red color. तो व्हाइट और रेड कलर की तरफ देखने से या सूरज की तरफ देखने से आंखों को तकलीफ होगी. आई यूजुअली यूज अपिस मेलिफिका इन केसेस ऑफ conjunctivitis coming in summer season. If you see any cases, you just ask the patient if he अगर वो पानी से धोता है, ठंडे पानी से, चेहरे पे ठंडे पानी मारेगा तो उसको सही लगता है या नहीं लगता है. If you want quick prescription, if he says yes to this, that cold water, if he is splashing cold water over his face and he is getting some betterment in those conjunctivitis, then you can think of Apis for sure shot in summer season.
Sir, is this page number 29 or 129?
Yes, 29.
So it's on 129.
No, sir, 129.
Sorry.
Yeah,
Okay,
I was
okay.
searching in that.
Yes, sometimes doctor is too confusing because
Yes.
four people are talking and talking.
No.
and nobody understands.
I have written wrongly the page number in my copy. Sorry
No,
for
it's
that. The next rubric, the page is on page number 190. Head pain, stitches, stinging, sun standing in.
Sir, please repeat.
Page number 190.
What rubric?
Head pain, stitching, stinging, sun standing in. The only remedy written over there is Barata carb. We usually know Barata carb as a chili remedy, but this is very contradictory symptom written over here. I don't have any personal experience. Now, it doesn't mean that patient standing in. You can consider this patient may have worked in summer, but considering only this one symptom, I don't think that you are going to get success after using Baratakar, because sun exposure from head sun exposure from, there are many remedies scattered in repertory. So this Baratakar, personally, I don't have any experience or I use any of the time. Okay. So the next rubric you will see on page number 191. Head, sunlight, sunshine aggravate. So here it is not necessary that the summer is going on. You can use this rubric. Aggravation from heat, which is from sunlight or sunshine. Head, sunlight, sunshine aggravate. You got the rubric?
Yeah.
Okay.
Yes, sir.
Then the next rubric is again we go to page number 231. Lacrimation, tears, burning hot, sun looking at. So हमने एक rubric देखा था, eyes looking sun at or anything white or red aggravate. The remedies were apis and lyco. Here the patient will complain of lacrimation or tears which are burning and hot, whatever the tears are coming, and he gets aggravated that when he looks towards the sun. So which remedies are written over there?
Staphysagria,
And one more.
Bryonia.
Sanguinaria.
So open page number 619 of PHATAK Mat Remedica. And read the lines. Please, sir, go ahead.
Medicine, sir, kindly.
Page number 619 of sanguinaria, please read.
Okay.
हा कोणाच आहे
आवाज कोणता येतोय आवाजला का
Please someone unmute yourself and talk. Page number 619.
Sanguinaria, eyes, lacrimation with coryza, tears hot.
Okay. So the patient if comes to you with coryza in summer with lacrimation and the what tears are he is getting, they are hot, and he cannot look towards the shining sun, or he gets aggravated after that, then in this case you can think of using this rubric. Okay, then second rubric is there, which is lacrimation sun in aggravate.
Sir, which page we missed
Same
out
page,
in that,
same page, same page, same.
which 231?
Yes, sir.
231. Lacrimation
Dry
sun
only, sir.
in aggravate. So here, so here the patient will have lacrimation which is aggravated whenever he is having exposure to the sun. Here it is not, the patient is looking towards the sun. Prior to this rubric, what the rubric was saying, when he was trying to look at the sun, then the lacrimations are getting aggravated. And here it is not necessary to look towards the sun, but the lacrimation whenever he goes out in sun, not necessary to be in summer, but in any season, then lacrimation will get aggravated. In this case, you will use this rubric. Personally, I don't have any experience to use this rubric in any of my case. You will we have seen the rubric. We have seen the remedy sanguinaria from PHATAK Mathematics for last rubric. You will open the Staphylococcus aureus now on page number 663 of PHATAK Mathematics.
So can you just let me know which is the rubric with the sanguinaria? I've missed that one, sorry.
Lacrimation, tears, burning hot, sun looking at. So Staphylococcus aureus, page number 663.
Yes,
Yes, sir. Hot tears run off the eyes, left on looking at the sun.
So you will have more predominant of the left side. Okay. And the most important thing in Staphylococcus aureus, that patient will feel, in spite of having lacrimation, patient will feel the eyes as dry. Okay, so the dryness is not marked in sanguinaria. Sanguinaria is a remedy which have profuse discharges, whatever it may be from nose or it may be from eyes. So the main differentiating point over here is sanguinaria have discharges more marked, but dryness is marked in Staphylococcus aureus, and the left side is more predominant in Staphylococcus aureus, which is not the case with sanguinaria. But sanguinaria will have the headache on right side also. So if the patient is having, if you want to generalize the concept of Boger over here, then you can consider if patient is having more tears or more complaints from right eye, you can consider sanguinaria, and if it is having more on left side, you can consider Staphylococcus aureus. Okay. So the last rubric and last 1 minute, you will go to page number 242, L light, sun aggravate and amelioration. So in general, it will have the aggravation from sunlight or amelioration from the sunlight. In general, you can use this rubric. The patient will not have any particular complaints, and cross reference to this rubric will be on page number 377, which is sunlight aggravate and ameliorate. It is also a general rubric. So what you will do, which rubric to be considered, which is it on page number 242 or 377? You take both the rubrics at one time.